Morning friends, this is Dr. Arun Dhir with you, and I'm here at the start of my operating list, and I am about to embark on a procedure which is called the Mini Gastric Bypass, or also known as single anastomosis gastric bypass. Now, some of you may have heard of this procedure. It has recently, when I say recently, since 2016, it has received the endorsement from the peak international body for obesity surgery, which is called IFSO. And it received the endorsement because it was a procedure that was found to be not only effective in diabetes or morbid obesity, and also in individuals with severe sleep apnea, which are all overweight related comorbidities, but it was also found to be particularly effective in diabetes because of its effect on the metabolic side of the physiology. So what I'm going to discuss today briefly in this video is the reason or the rationale behind choosing a mini gastric bypass. Now, a mini gastric bypass or a single anastomosis gastric bypass, as the name suggests, is a smaller version of the double joint or the Roux-en-Y gastric bypass. The way I explain it to my patients in terms of choosing between different kind of operative procedures really is that imagine if you have to take a domestic flight to go from one city, like I live in Melbourne, from Melbourne to Sydney, for example, you would take a different kind, you'd be boarding a different kind of an aircraft which has got the ability to travel that shorter distance. But say if you have to take an international flight, which is going to span over 14, 15 hours of flying time, well, you will be taking a different, or you'd be boarding a different kind of an aircraft, which has the capacity to take you in a non-stop fashion over that longer distance. The same analogy applies when you are choosing between a band, a sleeve, and a bypass. And what I generally say is that if your BMI is above 50, you've got established comorbidities such as diabetes, high blood pressure, sleep apnea, and very importantly, also eating behavioral things around, say, preference for sweets and things like that. Well, I guess a bypass is going to be a more powerful, more effective operation for you. Of course, all of this depends on the assessments made by your individual surgeon and what is their best recommendation for you. But let me introduce you today to my patient who we are going to go in together, who is kindly consented to agree to share her thoughts with you about the rationale or the reasons why she decided to consider the mini bypass for her choice of bariatric operation. So I've got Leifa over here. Leifa, I'm going to get you to say hello, a brief hello to our audience. Awesome. And I'm going to get you the mic over here. Awesome. So do you want to just tell us, Leifa, what got you to consider the mini bypass as a choice of your procedure?
Yeah. For me, going through this is obviously quite a big step.
Exactly.
And so I'm happy to take best advice in terms of what is best for me.
Yes.
And when you were talking through it with me, particularly, I have a family history of diabetes.
Yes.
I'm showing some of those risks myself.
Yes.
So having an operation that gives me the best chance to go forward with the best health is really the most important part for me.
Awesome. Do you also have issues around sleep apnea?
I do.
And okay.
I do. So I use a CPAP machine.
Right.
I have chronic fatigue syndrome. So
Yes.
the combination of
that.
bad sleep along with mild sleep apnea has made things quite difficult. So the thought of not being needing to use that machine or getting any kind of relief with sleep apnea is a good thing too.
Yeah. Now, did you do any research yourself in terms of the mini bypass, or before you came to see me, or after you saw me?
I definitely had researched all the options before I came to see you. I've done a bit of reading, and I guess because it seems so common, was expecting to be talking to you about the sleeve more so.
Yes.
So I'd read the information but hadn't sort of focused in on one way or another as being what I wanted. So after you gave me the information, I went away and had a look, and I could see where you were coming from in terms of why some of those needs matched what I need to deal with.
Awesome. So how do you feel moving forward
Good. I'm feeling positive at this point.
Excellent.
Looking forward to having the surgery and seeing what life's like on the other side.
Lovely. Hey, we wish you best of luck.
Thank you very much.
Awesome. And we will see you in shortly.
Thanks.
Take care later.
Bye.
Excellent. So I guess that's where I will say that, take an informed decision. Make sure that you have done your research, and there is a lot of information out there, but what is crucial to understand is get your information from a valid source, whoever it may be, a trusted source, not just on some forum on Google or wherever. I guess you got to rely, it's a decision that you are making for the rest of your life. So good luck with everything, and I wish you all the best. Bye.